Without further ado, I'd like to introduce Dr. Andrew Maccabe. He is the Chief Executive Officer of the Association of American Veterinary Medical Colleges. On there, his complete biography is in the proceedings. He does have a few turns in his career, i.e. worked in a mixed animal practice, with specialized in dairy medicine, then into the Air Force, earned his Juris Doctor degree, and then back through the back to the AAVMC. So, with that, I'll turn it over to you, Dr. Maccabe.
Very good. Thank you for the introduction and for the opportunity to visit with you here today. I want to give you a little bit of an update about what we've been doing in academic veterinary medicine to get organized to rise to this challenge of antimicrobial resistance. Most of you are familiar with these various global and national action plans that have called attention to this issue over the last decade or so. The reason I put them all up here together is to indicate the uniform call for a One Health approach to this issue. The point of that being that this is not just a human medical problem or an animal health problem or an environmental problem. It's collectively all of us need to work on it together. So what we noticed, though, is that of all the activities going on in this area is that academia in general had not really stood up to the challenge. There were a lot of different efforts going on at different schools with independent researchers working diligently in this area, and many of you may be some of those people or at least know them. But collectively, we had not marshaled our resources to address this. So we partnered with the Association of Public and Land-Grant Universities to form a task force that would represent the veterinary medical colleges and the colleges of agriculture. We also brought into that mix observers from government, from CDC, FDA, and USDA, and also from industry. And again, many of these groups are represented here as well. A little bit about APLU. There's the write-up. It's a big organization. It has a lot of capacity. And I guess the number I want to focus on there is in that second bullet, over 237 public universities throughout North America. A little bit about AAVMC. We represent all of the veterinary medical colleges in the United States and Canada, as well as 14 more around the world that have all ascribed to the same accreditation standard. And again, the point here is that collectively our two associations have an international presence and a global footprint, and that's important when we talk about an issue like antimicrobial resistance, which of course does not respect boundaries, political boundaries, and so we need to be able to work on this in a global way. So we had this task force that was chartered about 3 years ago. The charge was to propose these recommendations in the areas of what academic institutions do, which is education, research, and outreach. Or in the new terminology for the land grants, it's learning, discovery, and engagement. But the point is that this is the mission area of public universities. And so our recommendations coming out of this task force focused in two big areas, education and outreach, which I'll talk about first, and then a little bit on the research area. So one of the recommendations was that we produce a model curriculum for veterinary medical students and animal science students at our public universities. And I'm not an educationalist myself, but I have been schooled by educationalists, and it turns out that model curriculum is out. That's old stuff. The new stuff is learning outcomes or competencies. And so it's appropriate for a group to come together and by consensus define what the learning outcomes should be But then we leave it up to each faculty at each institution to determine how they're going to deliver a curriculum to achieve those outcomes. So we put together this group, and they came up with learning outcomes at 3 different levels of learning. The novice area would be youth, 4-H, that type of thing. Intermediate would be at the undergraduate or baccalaureate level, and advanced would be at the professional and graduate level. So at those 3 different levels, and then they looked across 6 different domains that are listed here, and they identified the specific learning outcomes that each learner should have at those different levels. And here's an example. This isn't meant for you to read, but you can see how it's laid out in this document. The 3 columns are the developmental level of learning, and then down, and this happens to be one of those 6 domains, antimicrobial stewardship. And then there's the various different elements, and then what each learner should have at those different levels. And again, the objective for this type of a document is to guide curricular development and bring some uniformity to all these different approaches so that we can say that learners at these different levels have achieved these outcomes. By the way, these guidelines, these learning outcomes, and the task force report are available on our website. If you were to Google AAVMC-APLU antimicrobial, you would get to this page where you can have these things available. In addition, we partnered with the Association of Prevention, Teaching, and Research, APTR, and this is a group that represents the faculty at medical schools that teach preventive medicine. So we partnered with APTR to develop these One Health case studies. And again, these are meant to be pull them off the shelf to use in the professional curriculum to engage health profession students at learning these various aspects of One Health. And the first round, we developed 15 of these case studies that are, again, available on our website. And about a third of them involved antimicrobial resistance. We have given some thought, since we've published the learning outcomes or the competencies for antimicrobial resistance, that perhaps we should do another round of One Health case studies focused exclusively on antimicrobial resistance. And we're still considering that, and we may have more to say on that later. In addition, we are pleased to be working with Jeff Bender, who is here from the University of Minnesota, and his group on the antimicrobial resistance learning site. This is began with a collaboration between Michigan State, University of Minnesota, and the Centers for Disease Control. Minnesota is now leading this effort. They have an entire curriculum available for veterinary students and veterinarians to look at these different aspects of antimicrobial resistance. And they're in the process now of reviewing and updating these materials and soliciting input for new materials. Also on the education and outreach area, we've gone through a series of briefings on Capitol Hill. Here's an example of 3 speakers that came to address staffers and members of Congress through the Veterinary Caucus of the House of Representatives. And again, we're trying to get this message out about our task force and these learning outcomes to a wide variety of audiences. The second main part of the task force report was the research needs. And the group basically divided these down into the basic and applied area, and then the studies and methodologies. And if you were to look at the complete list that's in the task force report, my sense is that very few people in here who are familiar with this issue would be surprised at what the recommendations for research are. These are pretty basic. Anybody who's been in this area would know that this is these are areas that we need to be working in. But what I wanted to point out is on the bottom right there that we need to bring in the social scientists and the behavioral scientists and the anthropologists. We need to look at what are the ways that we can incentivize and change behavior of people, because I think that's a part that we've been missing far too long. Finally, we are proposing the creation of an antimicrobial research and education institute to provide global research in this area. As I said, our current situation is that we have many researchers spread out across the nation through our public research system that are all working on a number of different projects, many of them funded by lots of different funders. And that's okay. We've made a lot of progress. There's a lot going on. But there is an opportunity, I think, to bring some synergy to that effort and to collectively form a research and education institute. Right now, we're working with APLU to further develop this idea. I will put in a plug for a session that will be held immediately following this meeting on Thursday afternoon, sponsored by the Foundation for Food and Agricultural Research, because they share these same ideals about bringing together industry, academia, and all stakeholders together to work at identifying the research needs and how we're going to proceed. So however we do that is yet to be determined, but I think there is a need to kind of bring these disparate groups together and get some synergies off of that. So that's all I had to say about our update, and I gather we'll have some time for questions at the end here, right?
Yes. Thank you, Dr. Maccabe. Next, we have Dr. Michael Costin with the American Veterinary Medical Association. He is a Kansas State grad, if you could tell by the lanyard here, so we appreciate that. Currently, he was in MEX practice, industry, and before he joined the AVMA in 2015 as the assistant director with the AVMA, where he is a staff liaison to the AVMA's Animal Agriculture Liaison Committee and the Committee on Antibiotics. Dr. Costin.
Thank you. On behalf of the American Veterinary Medical Association, I'd like to extend our thanks to the NIAA for inviting us to participate in this meeting. As the invited representative of the nation's largest veterinary association, I am privileged and honored to represent our 90,000 members. We are a diverse group, yet a small profession, and we serve societal needs across the entire health spectrum. I want to emphasize at this early point in my remarks that the AVMA is committed to ensuring that medically important antimicrobials remain effective medicines. Our focus is on understanding and promoting good stewardship, which we believe is the best approach to mitigating resistance while ensuring that we continue to have access to effective antimicrobials to treat our patients. We know that antimicrobials, when used properly, can save lives. We also know that they should be used judiciously and in the best interest of animal health and welfare as well as public health. Advocating for the appropriate use of antimicrobials is nothing new for the AVMA. We can go back 10 years or more to find AVMA policies and congressional testimonies related to their use and our concerns about resistance. As society's concerns about resistance have grown stronger, we have increased our efforts to ensure that veterinarians continue to be vigilant and that we maintain our place among those whose responsibility it is to protect all of society when it comes to antimicrobial use. Let me provide some examples of how the AVMA is working with a variety of internal and external stakeholders to develop principles and guidance for judicious use as well as facilitate their adoption. As you know, implementation of the Veterinary Feed Directive went into effect on January 1st. As this rule was developed, the AVMA was an essential collaborator with the Food and Drug Administration regarding the profession's needs as well as what we perceived veterinarians' roles in judicious antimicrobial use should be. Our volunteers and our staff provided the FDA with expertise and guidance for improving the existing VFD process, and many of our suggestions were incorporated into the final rule. Since the VFD rule went into effect, veterinarians have become even more attuned to how medicated feeds are being used in their clients' operations. To assure veterinarians familiarity with revised requirements for issuing VFDs and to help them understand their associated professional responsibilities and legal obligations, the AVMA embarked on an extensive education campaign. A variety of resources that clearly explain the ins and outs of VFDs and that assist with the implementation of the rule are available on the AVMA's website, as well as the websites of our allied veterinary associations. These website resources have been supplemented by numerous continuing education opportunities in various venues. I believe Dr. Flynn brought this up. As an example, the VFD revisions place antimicrobials used to treat honeybees under veterinary purview. Because this is an area of animal care where veterinarians have historically had less involvement, the AVMA developed resources for our members to help them work effectively with beekeepers to protect honeybee health. Similar materials have been and continue to be developed for aquaculture. Just as a point of reference, our beekeeper resources on our website, as of a few weeks ago, we had over 14,000 views, which is exclusive to veterinarians because it is behind the veterinary member wall. At the convention last summer in Indianapolis, we had over 450 people in attendance at our bee continuing education seminars. So regarding these educational opportunities, we have notified our members of the availability of these learning opportunities, and our resources ensure veterinarians are well positioned to assist their clients, their producers, in following the VFD rules. We also have a wide variety of policies related to antimicrobials and their use that not only guide our members, but are also considered a gold standard by both legislative and regulatory bodies. I won't go through all of these with you, but the list on the screen shows you some of the variety, depth, and breadth of our thinking when it comes to antimicrobial use and the associated responsibilities that veterinarians have. These policies, which have been developed over nearly 2 decades, and we revisit regularly on a 5-year basis at least, to ensure relevancy and to reflect the emerging science. These are the result of the hard work and dedication of a long list of AVMA volunteers who are passionate about animal health and welfare as well as public health. These volunteers provide broad representation and expertise across disciplines and service sectors. They include veterinarians who are in practice, research, regulatory medicine, academia, and uniformed service. Their areas focus from bovine, swine, equine, small ruminants, poultry, companion animals, zoos and wildlife, aquaculture, as well as pharmacology, epidemiology, and public health, just to name a few. They're truly representative of the entire veterinary profession, which is diverse in interest as well as insight. So this is why I guess I am really here to give you an update on what we've been up to in the last year. Just last year, the AVMA's Board of Directors established a new committee, the Committee on Antimicrobials, which is advisory to the board and now has oversight of all antimicrobial issues for the AVMA. Bringing oversight into a single entity as opposed to several which had similar but separate responsibilities promises to better focus our expertise as well as our resources, as well as enhance our ability to effectively and timely make decisions in an effective and timely manner regarding antimicrobial issues. The committee has been charged with developing and recommending an overarching strategy that allows the veterinary profession to effectively share robust and comprehensive recommendations for policy and its implementation with legislators, regulators, the marketplace, and stakeholders. Furthermore, the committee serves as the lead AVMA entity in the association's collaboration with similarly focused stakeholders, including human medical community, in a One Health approach to the overarching issue of antimicrobial resistance. The committee consists of 9 voting seats. Each seat has a primary as well as an alternate member. Both members must be members of the AVMA with backgrounds in either pharmacology, microbiology, epidemiology, or public health, or they have to have a documented history of productive contributions in antimicrobials or antimicrobial resistance. Formed just last year, the committee has already made quite a bit of progress reviewing the AVMA's 21 policies on antimicrobials. Committee has reviewed, summarized, and made recommendations to either merge, reaffirm, revise, or rescind these policies. Additionally, the Committee on Antimicrobials has developed and a strategy regarding antimicrobials for the AVMA that aligns with the AVMA's 3-year strategic objectives. That strategy has been approved by the AVMA board. So the strategy itself focuses on education, advocacy, and improving member value. The strategy directs the AVMA to build consensus on antimicrobial stewardship and provide leadership on antimicrobial use and mitigating resistance. It also directs the AVMA to serve as a trusted source of information for both internal and external stakeholders. Going forward, the AVMA will support veterinary oversight of antimicrobial use by developing policy, providing resources for members, and engaging in legislative and regulatory advocacy. The AVMA will work collaboratively with stakeholders across animal and human health to embrace shared values to maintain antimicrobial effectiveness and mitigate antimicrobial resistance. And finally, the AVMA will promote antibiotic stewardship through the development of a unifying definition of stewardship for the veterinary profession and identify core principles to serve as a framework to support species-specific stewardship and clinical guidance. So I'd like to touch on this last point a little bit. If you look around this room, everyone in this room would most likely define stewardship slightly differently. The AVMA realized that in order for us to advocate for all veterinarians, regardless of the type of practice they are in, we needed to develop a definition for veterinary stewardship that would be widely accepted across the profession. Additionally, we are trying to identify core principles that reach across the different practice modalities to serve as like a common foundation to be considered when different groups are developing species-specific stewardship guidelines. And we realize that other organizations have already developed programs to assist with judicious use. Examples would be like the beef quality assurance or pork quality assurance, to name just a couple of the many that are available. Our goal is not to supplant these. Our goal is rather to find the common theme and a way to draw these all together, allowing veterinarians, regardless of their practice type, to work towards better stewardship of our antimicrobials. Okay. It is our intention that all of these efforts complement the broader issue of what we as an association see as critically important for the future, which is ensuring that antimicrobials remain available and effective tools for all. The AVMA is collaborating with our allied veterinary groups as well as external stakeholders to develop consistent stewardship and judicious use guidelines for the entire profession. Whether we're talking about cattle, pigs, poultry, or companion animals, it is our goal now and moving into the future to ensure that all veterinarians understand the role they play in the proper use of antimicrobials and the prevention of resistance. So in closing, the AVMA is leading veterinary medicine's work around this issue, and I submit that you and society as a whole can continue to rely on us as a trusted partner in ensuring the preservation of medically important antimicrobials today and moving into the future. Veterinary medicine, in concert with human medicine and other scientific disciplines, has an important role to play in combating antimicrobial resistance, and we at the AVMA are committed to the task, and we stand ready to provide our service, our science, and our expertise. So, thank you.
Thank you, Dr. Costin. And last but not least is Dr. Tewari, because I'm not going to say your first name because I know you just go by Deep, right? Dr. Deep Tewari. He is the director of the Pennsylvania Veterinary Laboratory at Harrisburg. He has been involved in numerous committees and organizations such as AAVLD, ACVM, and is currently the incoming vice president for AAVLD. So his research interests are emerging animal infections, zoonotic diseases, and antimicrobial resistance. So, Dr. Tewari.
Thank you. So it's my privilege today to speak to you all and represent one of the diagnostic laboratories that puts out the results for antimicrobials and the bugs that are tested in the laboratories. And we are one of the few laboratories that are part of a couple of the networks that are in the United States. So the top figure is the AAVLD labs, and you see a lot of colors on there. The ones that are not colored, those are the states that where AAVLD labs are currently not there. AAVLD represents the American Association of Veterinary Lab Diagnosticians, and it's an accreditation to the lab system for really achieving a certain level of quality control and performance and reliability of results that you received as producers on the farms or as veterinarians in your offices. The National Animal Health Lab Network is a USDA-sponsored network for addressing diseases of high consequence. And interestingly, since the CARB initiative got declared, NALN has taken this initiative to include the antimicrobial resistance monitoring within the scope of their work also. The Lab Investigation Response Network, which is also part of the FDA, I'm not sure if anyone is representing LEARN here, but they do an important part of the work also, addressing the small animal side of the response that the labs offer. Then there are many university research and clinics that offer the diagnostic susceptibility testing also. What are the methods that are used for antimicrobial susceptibility testing? And they have not changed for a long time, even though the discoveries are going on in figuring out the resistance in using genomics or using other detection methods, but primarily the labs use the MIC or breakpoint determination or the disk diffusion methods for susceptibility determination. What do the diagnostic lab report? They certainly don't report the treatment advice. These are antibiograms that do help in making the decisions for treatment. And as we talk about bringing the resources together regarding the education, I think using that lab data to derive better decision points for the treatment is going to be very critical as we move on this path in antibiotic stewardship. The labs also provide disclaimers on the report that these, the treating veterinarian has to decide on the efficacy, the residue issues, to decide the best course for treatment. The drugs reported, the drugs tested are reported. The results are simply reported as susceptible, resistant, or intermediate. And oftentimes when MIC testing or minimum inhibitory concentrations are derived, those results are also provided for making treatment decisions based on the pharmacokinetics and pharmacodynamics data. The trends sometimes are also reported from the laboratories, and that certainly is not a universal rule, but many times labs would put together the retrospective data and they'll provide the information to see what the resistance patterns are developing. This is just to show what goes on in diagnostic labs, and this is a summary of somewhere close to 40-some labs, and shows the variance in the results as you can, even though they run testing methods using a uniform standard method, but the results can be different. So the column on the left, as you see them, I would have predicted that they should have all come out as one color, as blue. But you do see the variation, and that goes all the way across. For some of the drugs that I took a look at, this is a interlab comparison that was administered to the AAVLD labs recently. So having said that, with the variation there, and the AAVLD working group, along with the National Animal Health Lab Network, just formed a working group to harmonize some of these methodologies further, that the results coming out should be consistent all across the laboratories. So whether you get that result from Kansas Pennsylvania, California, those results, whether they come from smaller labs or big labs, should be identical in helping make the treatment decisions. So the working group actually put out a survey to figure out what is going on. This survey is published now in Journal of Veterinary Diagnostic Investigation this year, and it pretty much points out that there are some differences in place in different diagnostic labs. So there were 21 questions that were asked across the laboratories when this survey was administered. What the labs said was that more than 50% of labs still are using the consensus guidance document in making determination for resistance versus susceptible, or setting up the tests in the laboratory. The methods most commonly used are still the disc diffusion and the commercial broth microdilution. In some cases, both capabilities exist in the laboratories. 94% of the labs do use the QCs recommended by the CLSI document. 61% of those laboratories also said that they use the commercial systems in making the determination. So making the system more automated in making the calls, but there are some drug-bug combination that require manual intervention in making the decision as to what is susceptible versus what is resistant. The sources of bacterial isolate in most of the diagnostic labs are clinical cases. So 94% of the tests that are run are on the isolates that are received from or grown in the laboratory from clinical cases. Some come from research projects, others come from monitoring or surveillance program. Certainly, we talked about One Health. There is collaboration with public health, environmental testing, and the clinical studies that contribute to the isolates too. Of the 98,788 tests performed, the survey indicated that largely the testing was done on dogs, followed with cattle, swine, horses, and cats. And the other categories, certainly, what is surprising is the poultry didn't jump out to be the top one, thinking that many of that, lot of that testing may be happening in the private lab setting or the industry-owned lab that is not reported here. And the next slide pretty much documents that what are the bacteria that were tested all across the species. So these are top 6 bacteria that are studied: E. coli, Pseudomonas, Staph, Pasteurella, Salmonella, and Staph aureus. This slide is interesting that whatever data is obtained in the laboratory, besides the client, that could be veterinarian or the owner or both, is not shared outside of that that client-patient relationship is maintained by the laboratories in a large number of cases. 46% of the labs have never been asked to share that data, 32% against confidentiality policy that they would not share, and some, there are other policies that make it difficult to share the data. So because there is 46% that have never shared that data or have never been asked, there is certainly an opportunity to actually get some of the data, summarize that, and see what is happening, because we have really, in isolated places, taken a look at that data, but never in a collection. USDA does do some studies, so if you look at the USAHA annual reports, you'll find Salmonella resistance data that they see nationally. But besides that, there are no national level data, unlike what we see in NORMS program or other places where we could see that there is actually resistance developing, or there are no changes at all in the years that we have conducted these testing. So NOLN and LEARN objectives, the two organizations have teamed together with some funding available from the federal side that to develop a process for tracking antimicrobial resistance data, standardize the methodologies, interpretation, and the reporting mechanism, deploy across multiple laboratories the same harmonized protocols, and also follow up with the genomic testing later on in the process to figure out whether there are resistant genes that are being carried on by the isolates, and do they jump across in different isolates in a setting. And then the facilitation of the antimicrobial stewardship, that is a common word today. Again, both the organizations along with the AAVLD would attempt to achieve that. And so far, NOLN has selected 19 laboratories, and the process would roll on from 2018. LEARN, that is part of FDA, has already started that work with the 4 labs and source labs that would be contributing the isolates. Those come primarily from the, for LEARN FDA project, those are coming primarily from the dog and cats. But in the cattle side, they are looking at all salmonella. On the NOLN side, it is these 5 pathogens, along with the species that they're going to be taking a look at. What are the resistant patterns? Can they be correlated genomically to code into a certain factors that can be studied in terms of epidemiological or some kind of other relationships that can be established. We heard about Minnesota, and in Pennsylvania, we have a similar kind of setup, driven more from the ground level up. The Pennsylvania Department of Health, University of Pennsylvania, I think Dr. Rankin would be speaking tomorrow, Penn State University, Dr. Dudley, Ed Dudley from Penn State, Pennsylvania Department of Agriculture, that is us, along with the 3 laboratories that are part of the PADL's diagnostic network, contribute to that knowledge. And then we're teaming up with the local colleges that also have the interest in the antimicrobial resistance development. And for last 10 years, I think the different units have been working together to make sure that we capture the data, we continue to collect the information, and share that publicly through the publication of the important findings in the diagnostic and the research community. I wanted to acknowledge the NOLN, Dr. Beth Harris, who's some of the slides you saw up on the screen, AAVLD, FDA, CLSI, APHIS, VS working group that helped to put together that survey and find out what exactly is going on in the diagnostic labs. LEARN network that has helped propagate some additional studies related to resistance. The PA Department of Health, who we interact here in Pennsylvania to really push the boundaries on the antimicrobial resistance, and the PA Department of Agriculture, where the 3 labs actually work together to address the same issue. With that, thank you.
Thank you, Dr. Tewari. So we have some time for questions. I don't think it's been mentioned before that we have index cards on your table. If you don't want to ask a question, you can fill out there as we go along. So feel free to use those as well as the mic. Go ahead.
Yeah, thanks, Deepanker, for your talk. And just a little bit of a comment. And as you say, Andrew, about behavioral science, you know, I'm learning a little bit about these based on what they're doing in the healthcare with value-based healthcare medicine. And what they're doing is basically looking at outcomes, because the reason to looking at outcomes and see what changes and then publish those outcomes and show to people how, you know, different doctors perform is the only way to change behavior. You know, you could tell people do this, do that, but they're not going to do it. You have to show them data and publish those outcomes and share that information. So that's the only way you're going to change behavior. So very interesting.
Great. Any comments on that, Dr. McCabe?
Well, one thing we appreciate that very much. One thing we know certainly is economics is a big driver, right? And so I think that what that points to is we also need to have the economists in the room with us when we do this. So right now, if the behavior is being influenced because it's a lowest cost thing, we need to recognize that and recognize the cost of other interventions, and then find out how to incorporate that into the whole behavioral change thing.
Hi. Tom Schroyak, Antimicrobial Consultants, LLC. I wanted to bring to your attention, you're probably already aware of this, last week was the NARMS meeting. The FDA Science Board report had a number of recommendations to improve NARMS over the years, one of which was to implement a nationwide pre-treatment target animal pathogen monitoring program, which may be a little bit different than what's currently ongoing, because these would be isolates collected from animals that are ill but have not yet been treated. That kind of a program is operational in Europe, has been for a number of years. So that was one key recommendation, along with embellishing some of the CLSI, veterinary AST methodology, and interpretive categories. Similarly, in the PACCARB incentives report issued in September, the Diagnostic Working Group was very keen to advocate additional support for CLSI to generate additional breakpoints, which are not in existence. And we certainly would definitely appreciate that sort of thing. So as I'm looking at the academic, the AVMA, and the diagnostic laboratory, this seems like a great opportunity for you guys to be able to comment on how the research can actually be done, and how that can then be impacted and related to the practitioner's decision tree making when it comes to judicious, responsible use, whatever we wish to call it. And then the key role of the laboratory communicating with the veterinarians relative to that information that's generated in the lab. So we have the research, the practitioner, and the lab practitioner interaction. Thanks.
Start.
So Tom, you make a very good point that that has always had me thinking that the isolates we received in the diagnostic labs are really the animals that are either very ill or going to die. And many times we receive postmortem, and that you could be looking at a biased specimen when you're trying to determine whether there is increased in resistance. So certainly looking at the healthy animals is an important part in making that determination. So whenever we analyze that data, that is always in our back of mind and in the writings, that this is a very focused or group that could be biased in terms of when we derive any interpretation. But certainly I think looking at all the folks here, it makes sense to us to collaborate with anyone out there that would help improve the system that is existing.
I would like to address your comment. You said the recommendation that came out of NARMS last week indicating, and I have not had a chance to read the report from that, but indicating that the disease should be diagnosed or prior to initiation of antimicrobial treatment? Is it
Pre-treatment sampling was what they were advocating on that, to get a pre-intervention sample to examine that bacteria.
Yeah, that's correct. It wasn't that you needed a diagnosis before you treat. But when the animals are ill, collectors sample then before an antibiotic is administered. That's what's going on in the hospitals and the human situation. So why should it be different in veterinary medicine? That's what really matters, because if you have susceptibility data, then you have a better shot at understanding what the right antibiotic will be, rather than a post-mortem sample where it's already failed more than likely. Does that help to explain what I was after?
Yes, it does.
Okay,
I believe that was also addressed in some of the proposed changes to Codex Alimentarius, Code of Practice, which is up for review under the Federal Register notice right now. The AVMA did just submit comments regarding this. We recognize that that would be a very useful tool, allowing us to go back and investigate if treatment failure does occur, why it occurred, what the causative organism was. There is some concern, especially due to the size of our production units, especially and looking at herd medicine or population medicine as opposed to individual medicine. Would that be cost and labor effective? Not to mention, when you're looking at a dairy, for example, of 5,000 animals, and how do they handle those samples? How does the veterinarian put that in handle those protocols? Backing up, we do recognize that it could be a useful tool. I'm not sure that the AVMA has taken an official position on whether it should or should not go forward yet.
Rick Sybil from Merck Animal Health. Andy, I'm going to put this in your camp. As our new next generation of medical professionals sort of go out into this brave, interesting antibiotic world, how is our institutions of higher learning preparing these students in that space? And if you know me, I have to tell a story. So I spent some time with 3 deans, and we were having a discussion about a couple of other things, and I asked all 3 deans of veterinary.
First of all, my condolences.
Yeah. So for those deans in the room, I didn't pick up the entire bill, which was a win for that night. But as I asked that question, how are we preparing students and how much effort are we sort of speaking to the issue of teaching these children, for lack of a better term, as they move into the real world, how much time are you spending in this space, and do you have real curriculum teaching them about the decision process to choose an antibiotic or not to choose an antibiotic? It wasn't a very positive answer. So help me and please affirm that they're making changes in the institutions in this space.
Yeah, so well, first of all, I want you to feel better. So whatever I say is aimed at that, Rick. That's the most important thing. The fact is that, when you've seen one veterinary school, you've seen one veterinary school. They all have different approaches to these things based on the strengths of the faculty and the unique attributes that they have. I think it is very clear that antimicrobial resistance and proper diagnosis and treatment is at the forefront of any veterinary medical curriculum. The challenge comes, that much of this comes to play in the clinical setting. So, we can spend a lot of time in the classroom setting and those types of things talking about these issues, but it doesn't really come out to play until the clinical setting. And that's where, we have to rely on clinicians that are demonstrating the best practices in terms of stewardship and judicious use of antimicrobials. And there, the faculty, we rely on faculty that have that are associated with their professional disciplines, typically their species groups. And I think you'd find that across the board, it's a pretty good picture. What you may have gotten when you ask any dean about, what are the schools doing in terms of this, where is this in the curriculum, it's a very challenging question to answer, because it's not like you can pick up and say, oh, in the 3rd hour of the 6th week of the 2nd year, they talk about this. And even if you can, that's really not relevant. It's not relevant until it all comes together in the clinical setting. So my take on this overall is that things are actually in pretty good shape. I think I don't have the agenda with me, but I know Jeff Bender is here, and I mentioned the work that they're doing with the antimicrobial resistance learning site and how that is getting improved. We also know that USDA in the accreditation system for veterinarians has included antimicrobial resistance as part of that testing. We know that it is part of the North American Veterinary Licensing Exam, and we know now that with these learning outcomes that we've developed, that interested faculty members will have the opportunity to include this, to direct their curriculum towards achieving the objectives, which I think is really the bigger piece here. So even though you might have gotten an answer that sounded a little bit, if they couldn't pinpoint directly and say, yes, our students, every one of them gets 6.5 hours of this and, has at least 4 questions on a test about that, we'll never get that specific. But I feel confident that the issue is being addressed and at the appropriate levels, and which again is mostly at the clinical level. We can put this all together. Do you feel better?
Question in the back, Dr. Smith.
Yes, I'd like to go back to Dr. Tewan's comments about the samples that are submitted to the diagnostic lab. In my world, the pathogens that are most important are bovine respiratory pathogens, and yes, those reports that we get from the diagnostic lab are mostly from treated animals. In a recent paper by Dr. Brian Lubers, he reported that in 2009, about 5% of the samples that came through the Kansas State University Diagnostic Laboratory were resistant to, or pan-resistant. And by 2011, I believe it was 35%. And then an addendum later on, we're up over 50% of those. So those are still animals that we treated a second time and a third time. So I do believe that the change in susceptibility as we go through the disease process is significant and important to us. And backing up a little bit, although my record system would be much less complete than that at a diagnostic laboratory, 2009 and earlier, I would see samples from animals that had died of BRD that were still susceptible upon laboratory testing. And about the same time that Kansas State University started observing the increase in resistance, we started seeing that in our practice. So my question is, do you think that there is a substantial mix of respiratory pathogens that are susceptible and those that are resistant in the same animal? And I'm going back to one other research summary that was presented at the AAVP in September of this year. I believe it was out of Mississippi, if I remember correctly. They did sample animals that were at high risk of developing BRD. They sampled those animals on the day that they treated them metaphylactically with an antibiotic, and they came back several days later and tested those animals, and there was a very, very significant change in the susceptibility patterns.
So a very good point that you make is what the diagnostic labs recover is the isolate or the clonotype they pick. And we know that the resistance within a population could change because of the pressures or because of the pressures of the growth, the pressures of the bug, what it has to deal with on a petri plate. So yes, I think there can be difference in clonotypes. And as the labs get better at defining these, using the proteomics tool, using the genomics tool, I think comparing within a population, whether there are organisms that are resistant versus susceptible within a given population, I think would be a good way to analyze some of those in future. But certainly a good point.
We have a question over here.
Hi, Dave White, University of Tennessee. Primarily for Deep, but I welcome any of the panelists. Building on this question, how do we get the diagnostic labs moving into whole genome sequencing and metagenomic testing of these samples coming in? Because the susceptibility phenotypic information is important, but I think we need to get into the genes as well and to seeing what's there between the normal microbiome and the pathogens as well. Thank you.
So Dave, thank you for bringing that up, and I think the support from FDA, the support from USDA, moving the technologies to the next level. As you saw me say that primarily the labs have relied on the phenotypic methods of detection for susceptibility and resistance. But as the funding comes through, I think back 5 years ago, this was when I attended one whole genome sequencing training. The costs were huge in terms of what the labs would have to invest to get that data. But those costs have been dropping significantly over a period of time. And it looks like already we are seeing that with avian flu, that those things can be combined rapidly within a day. I think the day is not far where we would get the same data coming out of the bugs that are recovered in the laboratory, go to the NGS and compile to see where the resistance and susceptible islands are. So I think, again, looks like we're moving in that direction. How much time it would take, that just remains to be seen, but I'm very positive with the costs that are dropping on the NGS scene. I think we have a future where we could look at the data more intrusively into the isolates than we have ever looked. Thank you.
Thank you. One more question we have. Yes.
Hi, I'm a large animal veterinarian here in Virginia, and I just wanted to make a quick comment on the last panel, if I may. Is that okay?
Yeah.
I think that the VFD is a great step in the right direction. And I understand Dr. Patel's frustration, but I don't think our fight is here in this room. I think our fight is with the media that tends to allow fake news and educate our consumers with alternative facts about how our food is produced in this country. I think we as producers and as veterinarians we failed miserably on educating the consumer as just to how safe our food is, how antibiotic free it is, and we need to do a better job. I don't think the VFD is contributing to this mass hysteria. I think it's more of just the fake news that we're bombarded with every day. That's all I wanted to say.
Thank you. With that, Dr. Bender, did you have a quick, hate to run, I'm missing your schedule up, Neville. Okay.
I did have a question actually to answer the question about our website. It actually is, it's amrls.umn.edu. It is actually a collaboration of a number of institutions, so that's a good thing. So we're trying to get the message out, and we're trying to gauge a number of colleges to have a resource, and then getting their input to make it better. But actually, I had a question for both Mike and Andy. One is that antimicrobial resistance is a global problem, and so I'm curious. I know that both institutions, both of your institutions, have a global reach. But how are we engaging the broader group of veterinary educators across the globe when we think about antibiotic use? So I wonder if you can comment basically on global veterinary efforts and how you're engaging that.
Thank you for the question, Dr. Bender. Right now, as I said in my presentation, AVMA has just transitioned the way we handle antimicrobials over to the new Committee on Antimicrobials just last year. This is a different tack than we've taken in the previous couple of decades. And one of the reasons they did this was because the AVMA's process in answering and making decisions was so slow. So just this past year, the new Committee on Antimicrobials has been focused primarily on our membership and trying to unify the different aspects of the veterinary profession and in developing the stewardship definition and identifying these core principles. I'm not saying that the global aspect is not important, but at this time, with the Committee on Antimicrobials directing the AVMA's actions on antimicrobials, it has not come up, and we have not taken a step on the global front, with the exception of answering Federal Register notices to OIE or Codex or things like that. So, Dr. Maccabe.
And just very quickly, I'd add to that what we're doing with our membership. You saw where our members are located in the world, so we have, of course, our direct outreach to those members through our own channels. But in addition, I've had the opportunity to describe our efforts at the European Association of Establishments of Veterinary Education, the veterinary schools of Australia and New Zealand, the Asian Association of Veterinary Schools. So at all of these various conferences among veterinary educators around the world, we've had the opportunity to share with them what our approach has been here, which is frankly a North American-centric view, because that's where the bulk of our members are. And as we said, we had representation on our task force from Canada and Mexico, but we're sharing with them the approach that we took and sharing with them the results of our task force report and the learning outcomes, which frankly are universal. They're not geographically oriented.
Well, great. Well, as you can tell that our panel has a very, again, diverse view of what's going on. It reinforces the fact that collaboration is essential across all stakeholders, and we see that with the collaborations among all these groups. It also shows you how complex the whole issue is. And if we think back to the slide of the elephant with the blind men that we had up there earlier, it would probably be pretty representative of everyone's different views in the rooms. And so with that, we thank you for your participation and your comments, and they'll be around to answer any questions. Let's give them one more round of applause.